So in this video we are going to talk about upper cervical spine mobility test. In that we are going to talk about two tests: cervical flexion rotation test and Pettman's distraction test. And we are also going to talk about the first rib mobility test. There are two tests to check the first rib mobility. Now we'll start with the upper cervical spine mobility test. So the first test is cervical flexion rotation test. In that, the patient is in a supine lying position. The examiner takes the patient's head in full flexion and then rotates the head towards left and right. At least 45 degrees of rotation on each side is noted. If there is any restriction less than 45 degrees of rotation on either side, that means there is restriction at C1, C2 articulation and there is a hypomobility at C1, C2 articulation. The second test is a Pettman's distraction test. Now, Pettman's distraction test checks what? So, Pettman's distraction test checks the tectorial membrane. Now, what is tectorial membrane? So, tectorial membrane is a strong band-like structure that covers the odontoid process and its surrounding ligaments. Now, in Pettman's distraction test, the patient is in the supine lying position. The examiner gives gentle traction to the cervical spine and takes the head of the patient into forward translation. Check for any pain or paresthesia. If not, move to the second step. What is second step? Second step, take the patient's head into flexion, full flexion, and then apply a little bit of traction. Check for any pain or paresthesia. If pain and paresthesia persist in flexion and traction movement together, that means there is laxity in the tectorial membrane. Now, we'll move back to the mobility test for the first rib. Now, first rib examination should be a part of a thoracic spine examination, but it should be considered in cervical spine examination if the patient has tightness or hypomobility in side flexion or any tenderness at the T1 spine or other palpation of the first rib. Now, how you perform the test? So the first test, the patient is in a supine lying position, relaxed. Examiner palpates the first rib just behind the clavicle and palpates on all the courses of the first rib. Then ask the patient to take the respiration, like take the deep breath in and out and check for the mobility of the first rib. So with the inspiration, the first rib moves up and the expiration, the first rib moves down. Compare both the side mobility of the first rib on left and right. Check for any restriction. The second step, while palpating the first rib, let's say on a left side, examiner takes the patient's head on a side flexion always on the opposite side and check for if the first rib moves a little bit upward and check on both the side. Means if you check the first rib on the right side, take the patient's head side flexion on the left side and check the mobility. And check for any hypomobility or hypermobility. In that case, there are two possibilities. Is there a hypomobility in the first rib or a tightness on the scalene muscle on the same side? The second part of the test where you check the mobility of the first rib, the patient is in a prone lying position. Palpate the first rib with one thumb and reinforce with the other thumb and move the first rib caudally. Caudally means downward direction, inferior direction, and check is there any hypomobility is there or not. Usually when the examiner presses the first rib caudally, there should be a firm tissue stretch. But check for any pain or other unusual sensations. Thank you.